It's a warm, beautiful summer day on July 7th, 2011. And you might say, what the heck are you doing inside? It's a beautiful sunshiny day after a big storm came sweeping through the North Country yesterday in real time. We had an appointment and we wanted to keep it right here at the Office for the Aging, part of the Clinton County Government Center complex on Margaret Street side. And we have Linda Thomas. Hi, Linda.
Hi, Gordy. How are you?
And Dorina Casio, whom I've known for, we decided, a long time.
Yes.
We probably know things about each other that we won't be sharing here today.
But I only know good things about you.
But, oh, that's very kind of you to say that. But I met you long before you had this business.
Yeah.
You worked for corrections for the Sheriff's Department for a long time.
Yeah, I worked for them for a little over 2 years, but then before that I was an outreach worker with JCO too.
Oh, of course, for a long time. So
Yeah.
we do go back a
Yeah.
ways.
Yes.
And I haven't worked for probation for quite a few years now. Linda, you and I have also known each other for a
Right.
long time. How long have you been here?
I've been here about 5 years.
Have you
And
really?
I kind of transferred over from Clinton County Department of Social Services, where I was a caseworker in foster care and preventive.
Now, do you know where the Clinton County Office for the Aging began? It wasn't in this building.
No, it's been moved around a few places.
Because I was telling Calvin as we walked in the door, I think this was the Department of Motor Vehicles
It
when I
was.
first came here.
It was. When I got my driver's license, there was windows all along this side,
Isn't
and
that
I used to
amazing?
walk up in here. Yeah.
Boy, so it's not your grandfather's place anymore, is it? It's all changed so much.
Well, just like the insurance. It's
Yeah.
not your grandfather's insurance any longer.
There
Or
is
your
a good,
grandmother's.
yeah, your grandmother too. There's a good reason for us being here today, and it involves information. I came over here when I was ready to retire. When I left the radio business, there was no retirement, there were no benefits. I just walked out the door, went to work for the county for 8 years, and did have a retirement that's about this big, but as I tell everybody, it's way better than a sharp stick.
Yeah.
When I came here for information, I had no idea what was going to happen. And so here we are. I'm
Yeah.
a survivor, thanks to the Clinton County Office for the Aging. But it dawns on me, just sitting here chatting before Calvin started the camera, that a lot of people are not familiar with this organization, what its aims and goals are, and they don't realize that there's help when they need it.
Right.
So start telling me a little bit about the Office for the Aging and what it does for people. Either way. You first, Linda, go ahead.
Well, we do a lot of things. We have a lot of programs, and we contract with other agencies to carry out some of these programs. We have the ISEP program, which is housed in this office, in this building, and we have the Caregivers Resource Center, that's also here, that's through Behavioral Health Services North, but they're housed in here. We obviously have the Senior Center on Margaret Street, or on North Catherine. We have the Senior Sentinel that we put out monthly. We do the high cap insurance counseling, which Doreen is the high cap counselor. We are both called Services for the Aging Specialist.
Ooh,
However,
nice title.
right,
Yeah.
big long government type title. Doreen, as I said, is the high cap counselor and coordinator, and I am the New York Connects coordinator. However, we do share the health insurance responsibilities back and forth. We both do the health insurance. My program, I'm trying to get information out about long-term care services. And we also work with people with disabilities, because people with disabilities very often also have Medicare at a younger age than 65. So that comes into play a lot in our office. So with my program, I'm trying to let people know they can contact us and we can help them muddle through the long-term care services, and services like Meals on Wheels, like Lifeline, like home health aides, maybe transportation's a problem. We just do a myriad of things here, and you can add to it, Doreen.
You know, I hear a lot of people who say, I have a certain situation. What am I going to do? There's no help anywhere. And so they sit there and muddle things over, and then they complain, and they're always, as they used to say in the service, there's always a certain number of people who don't get the word.
Yeah.
So it's important, and you and I mentioned this before this program began, it's important to get the word out, and you guys have been working very hard at that.
Well, we keep trying to come up with all different ways. Office for the Aging has a focus directory with all kinds of focus information in it. The information throughout Clinton County regards information on all different services here for people, contact people, contact numbers, as well as a little bit of information on what that group or organization does. It also has lists of senior housings in it. It has lists of legal services. Office for the Aging has a contract with John Klute's office for specific things, and we always tell people if you have a question whether or not it's will be taken care of through our contract with him, call down there. They are very nice to be able to answer your questions. But also we give referrals to like legal aid or the rural law center. Depends on the situation. We always tell people call, because if we don't know ourselves, we'll be glad to do some research and do referrals.
And even call back later. We'll say, you know, I haven't heard of that. I have not heard of that, but let me get your number and let me check it out, you know. And we'll we'll go online, we'll make phone calls, we'll call the state, we'll call whatever, and try to get an answer. And try, if we can't perform the task for the person, we definitely can at least point them in another direction.
Communication is better all the time between agencies. That's a good thing.
Well, here in Clinton County, when we go to different trainings, we are shocked to hear them complaining about different things.
Right.
Our county is beautiful, because we can pick up the phone and call any agency. If we're working with a client and we have a question, we can pick up the phone and call them. If it's Social Security, if it's Department of Social Services, if it's any of the other agencies and we're working with them and have a question, we pick up the phone, and when they're here, we usually have that answer for them and can find out whether or not they need to go further with an application, something has messed up or something just not in the system right, and we can usually help.
And that's extremely important, because the client is in the office at that time. And if we can't get an answer from Social Security, if we can't get an answer from Social Services, we don't have that answer, and we don't have access to that information.
Well, in reality, it's all a package anyway.
Right.
And many individuals have needs from various agencies.
Mm-hmm. Right.
And why not be able to communicate and coordinate those efforts?
Well, in a way, we're helping the other agencies
Of
too.
course.
Because we're preventing that client from calling them or maybe going there. If we can.
I like it when you say that we're the envy of other counties.
We are.
Because, you know, every time Calvin hits that on button and I sit before this microphone, I find myself crowing about this specific area we live in.
Oh.
We love rural communities, small cities like Plattsburgh. We think life is better here in Clinton County in northern New York than in many other places, and I've been to many other places.
It
So
is
have you.
better.
It is better, but you know why? Because people like you help to make it that way. It's a coordinated effort between all the people and all the agencies, and I love to watch it grow. But today is a day when we need to really outline some of the things that the Office for the Aging does that are specific. Most offices for the aging have the same kinds of programs, but the typical person who calls you or stops in on a given day, what are they looking for?
Well, right
Farmers
now,
market coupons.
yeah.
Oh, really?
Right now we have farmer market coupons.
No kidding.
Oh, yes.
I thought you were kidding.
No. I pulled up the paperwork, but we do. The person has to be at least 60 years old.
Oh, I can
Okay.
do that.
All right, and their income, depending on their household, if it's one person, it's $1,679 a month. And if it's two people, it's $2,268. If it's more, we figure out the income levels. But it's $20, $5, $4 coupons that they get to spend at the farmers market. And
Wow.
And we get phone calls as soon as heat ends, because we also do heat
Yep.
here. We're alternate certifiers for Department of Social Service for the heat program for people that are 60 and older also. But as soon as heat ends, they start talking about the farmer market being open, we start getting phone calls. So,
I love it, isn't it?
Yeah.
That's kind of a unique thing to this area too, isn't it, huh?
Yeah.
And we also make sure they go to some of the housing
Yeah.
programs and
Housing is
nutrition
vital,
centers.
right?
Right.
That's a vital part of the whole thing for seniors.
Well, there's never enough.
That's why we have New York Connects, is to try to help people stay in their own homes if possible.
Well, I knew you
And
run
then
that
from
program,
there-
Linda, but I never knew what it was. Tell me a little bit more about it.
Well, it's a referral and information program, basically, but we also have a website, New York, the state does also, there's a state website, New York Connects Clinton County website, and you can go on it and actually request information, input your information, and look for services. And/or you're more than welcome to call here, and we'll give them the same kind of
Yeah,
information.
let's continually mention how they can get a hold of you. First of all, the address is
135 Margaret Street.
easy to find on Margaret Street.
Yeah.
It's the older portions of the Clinton County Government Center.
Yeah.
Right.
Yep. And we do have a ramp. We tell people we do have a ramp. We understand the parking on Margaret Street is difficult sometimes.
I was so lucky. I got a spot right out front.
Oh, boy.
You are definitely.
Lord.
That would definitely be a thank you. But we
Don't
do,
stay here longer than 2 hours.
You might get a ticket.
I'll talk fast.
but the thing is that we understand that. But we do have some people that will park in the government center, come through the government center down their ramp and up ours. You know, depending on how much they can walk, and sometimes it's easier for them to park back there. So we tell them, you know, park wherever you can. When it comes to the high cap portion, we do prefer that they call for an appointment because we can be with a person.
3 to 4 hours.
Yes, easy.
Oh, sure. It
Easy.
takes time.
I was with
Easy.
someone yesterday for 3 hours.
Yeah,
Yeah.
it takes time.
And we both have been with people 4 and 5 hours.
So it is better to call. What's the phone number?
565-4620.
It's a 518 prefix for
Yes,
people who
it-
might watch this outside the
Yeah.
area.
Yeah.
You probably have an office for the aging wherever you are.
Oh, we have, if they're in Clinton County or throughout the United States, we do have phone numbers for that.
You got
So-
the, sure.
Yeah,
that's-
we have the phone numbers, and we get phone calls from people that are in Florida or having family go down to Florida, and they want to be able to contact them to find out what services are available for them in Florida. We have people that are all over the United States that maybe family is going to be moving with them, and they want to know a contact number. We give them to them. Here in New York State, we also have everybody's contact name and phone number, address, email address.
And the
for anybody.
website has links to everywhere.
Yeah.
Probably
Yeah.
the latest movies, I don't know. But I mean, I was looking at the website over the last couple of days, and
Yeah.
it's expanded a lot.
Yeah.
So people can just get on the website. I forgot what it is. I just put in Clinton County Office for the Aging,
Yes.
and it comes up.
Yeah, and you can go to the Clinton County website, and we have a link on there.
Right on
Yeah,
there, too.
yeah. And when you went through our website, you also probably saw these,
Oh,
our,
yes.
our snapshots,
We've been working on these.
which we've been working on, and we
Those are
send to
great.
people. And we send those all over the United States too, because
So what's it all about? Tell me this.
the snapshots are an idea that came about through other counties, and they're all different subjects from that people ask for on Medicare, Medicaid, long-term care, Medicare savings programs, North Country Home Services, private hire
You
care.
got it all.
All
Clinton
kinds
County
of-
nursing homes. What's this say? What does this mean?
ISEP is enhanced in-home services to keep.
Expanded in-home
Yeah,
services
that's
for
what it
elderly
is.
program. I could never remember all those letters.
But that's a program that's housed
This
here in
is
Clinton County.
exactly just like it says. It's a quick snapshot. You can look and say, you
I
know,
like
you know
that
what?
idea.
This might work for me.
Rather
This is
than
looking-
wading through pages and pages.
Right.
Right,
And high cap, is it?
yeah.
Health insurance information,
Information.
counseling and assistance
Assistance.
programs,
I know that one for sure.
home delivered meals,
Right,
hospice and transitions, of course.
right.
Medicare, North Country Home Services. How many of these are there?
I don't know, we keep
We
adding.
don't know. We just-
Nutrition, education,
we keep
nutrition,
working on them.
counseling, personal emergency response, private hire home care list, senior center, it goes on and on, senior meal sites.
Right. Yep.
What a wonderful
And
idea.
we're also been working on one that has, like soup kitchens and that kind of stuff. Because
Sure.
we've been getting more calls on that. So
Right.
we've been putting together a list for that kind of information too, and it will be a snapshot. So people can call here, and if they have specific things, we send them that, and often we'll just put a focus directory in with it. But people can also always go online to check out that.
Some
kind of stuff.
people, especially seniors, do not want to be bothered with learning how to work computers.
Exactly.
Right.
But everybody has a telephone.
Yeah.
And one way or the other, they can find a way to contact you.
Right.
Nobody should be alone in this day and age with a problem that can be handled by an organization like yours or any other here in Clinton County, because you've got connections with everybody. What other phases or facts or departments here at Office for the Aging have we not talked about yet? Because I want to talk about Epic and Medicare and so on.
Okay, you want to talk about HICAP now?
Sure.
Okay, HICAP, as you explained it, it's a health insurance information counseling program, and it is both federally and state funded. It's a grant program, and what we do is basically, I have people that come in. Linda has people come in. We have a part-time person named Ron Gist. He's learning all this. Plus, we have a contract with JCO, the Senior Outreach Program. So anyone here in Clinton County that is 60 or older, JCO can go out and see. But anyone that has Medicare, we can see here in the office. They do not have to be a specific age as long as they're about ready or are enrolled in Medicare. So we tell people, if you have questions or problems with it, call us. But the big thing that's going on right now is the huge Epic changes. We have people that have been enrolled in Epic since it started.
What is Epic?
Epic is a New York State prescription program. It's only New York State. It's the thing is, it's called an SPAP. It's a State Pharmaceutical Assistance Program. Okay, another one of those little acronyms, abbreviations.
Yeah.
But anyway, here in New York State, this program has been around about 21, 22 years at least. And people are so used to the way it has been. Okay, so they think, oh, Epic's not going to change, Epic's not going to change. Well, when Medicare Part D came in existence in June of 2006, I wasn't here at that time, Linda was.
I don't remember that.
I came over from training, but I was not here during that big bulk of stuff. But Epic was telling everybody, don't worry, Epic's not going to change, it's going to stay the same. Well, within a year or two, Epic did change. It required people that it wouldn't interfere with their insurance to also enroll in a Medicare Part D. But people within from a single person 20,000 or less for income, or a married person with 23,000. A married person with 26,000 or less, Epic would pay their Part D premium up to a certain level. And so basically, they were feeling like everything was the same. Okay, they just had a Part D plan and then Epic would pay the rest, and they didn't have a premium. They just continued to pay Epic like they have been. Well, Epic is drastically changing for our seniors. This month, July 1st, it started changing for anybody that has been considered in the deductible, so that if their income level was above the $20,000 for a single or above the $23,000 for a married person, they were in a phase called deductible. And anyone that's in Epic knows, well, I pay Epic or I don't pay Epic. They don't think fee or deductible. So the people that did not have to pay Epic but had to pay their Part D plan have been in Epic deductible. So in the beginning of this year, Epic gave anybody that was in that deductible portion $464 credit to pay their Part D plan. Well, as of July 1st, they took it back. So as of July 1st,
Oh, why am I laughing?
as of July 1st, anybody that had met their deductible, we have some people that were just over that 20,000, so their deductible might have been around $50. It was pretty close to that. But so they met it maybe back in January or February. Well, now they go back to pick up their prescriptions in July, and they have another deductible of $464 that they have to meet. Okay, it doesn't happen to those little people. That's 20,000 or above, but that's a different phase. They have it too. So anybody that's been in that deductible since January 1st have that $464 they have to meet. Okay, but then there's another wrinkle for people that have been in the deductible, but their income that they reported to Epic is, for a single person, is $23,000 or less, or a married person married couple that's $29,000 or less. They have that deductible they have to meet. Okay, but as of January 1st, Epic will pay their Part D premium up to I forget the amount.
$38.69.
Thank you. $38.69.
Wow, very good, Linda. Good.
My mind just went blank. Up to $38.69. So Epic will pay their Part D premium starting July 1st, but they still have to meet that deductible. Okay, so people, so if anyone. A lot of these people say, well, I'm just going to have it come out of my checking account automatically, or I'm going to have it come out of the Social Security. And if they don't realize that Epic's going to pay as of July 1st, and it takes them a month or two to catch up sometimes.
Oh, sure it does.
Okay,
That's true.
so if they don't realize that Epic's going to pay for it, then the Part D plan's going to get two payments for the same time, and oh yeah.
Oh, boy.
So that's just for
See,
July.
There's enough wrinkles when you get older
Yeah,
without all
exactly.
these new wrinkles.
Yeah.
And if it's confusing to me, how must it be for somebody whose home you go into and try to explain it to them, or they come into your office?
Mhm.
You
It's
have to,
very
you have to be
confusing.
patient.
Right.
And it's hard for you folks to learn it.
Well, we get trainings. We have conference call at least once a month on anything that's new, anything that's come up. We may have anywhere between 5 and 20 emails during a day sometimes, just on all the updated information, things from state or federal or anywhere, on all these different programs or changes, especially when they're hitting the beginning to start up. And we try to get the information as soon as possible, and as soon as they give it to us, we're going over it and mulling it over.
We
and
talk about it
yeah.
together and try to make sure we understand it.
Do you think it's important for seniors, even the ones that you've dealt with before, to stay in contact with you for these updates? Should they call you once in a while?
Well, see, the thing with Epic never mails out junk mail. So we
I
always,
heard you say that in a radio interview,
Yes.
but that's important to mention that.
right, Epic,
Considering how much junk mail we get in the course of a day.
oh, you're gonna get lots more because
Oh, yeah.
open enrollment starts October
Oh, I
15th.
know.
So all these plans are gonna start, and then regulations and stuff have changed for the Medicare Advantage plan. So you're gonna get it all year
Oh,
long, some
sure.
of it. But the thing is, Epic never mails out junk mail. So we always tell people, open your letters, because we often get copies of these letters, and Epic lately has been putting a code in the corner. So if they either tell us the code in the corner, or if they read us if they read us the first line or two,
Right.
we'll know what letter they've gotten.
Or what color the letter is.
Or what color the letter is.
Of course,
Oh, yeah.
color-coded, sure.
Oh yeah, some things we get color coded too. So that's what I'm saying. Epic doesn't mail junk mail. So anybody that's gotten I have people that say, during you're talking about letters, I haven't received any letter from Epic. Then I said, this change in July does not affect you. You will
Good
be
point.
getting
Excellent point.
you will be getting letters
Don't
in
worry
September.
about things that don't affect
Exactly.
you.
Right.
Yeah, you will be getting letters around September for January's changes. They want to get them out early enough so people understand that if they want to make changes, they do make changes so that their Part D plan is effective for January 1st when all these changes for Epic go into place. Because people are Part D plans right now, even the benchmark plans, a lot of them have a deductible of $310 a month. That $310, if they were an Epic fee before, Epic was paying their Part D premium, they had a cap on their drugs, no more than $20 a month, or even a 3-month supply, no more than $20. Epic is no longer going to do that. So Epic will pay their monthly premium up to the benchmark, but they will no longer have a cap on their drug costs. So if they're in a drug plan that has a $310 deductible, they have to pay that first out of pocket.
You know, it dawns on me that we should tell people who aren't on Medicare, Medicaid, or anything else yet what we're talking about. What does it mean when you talk about Medicare Part D? Explain that to the uninitiated.
Okay, in 2006, law went into place that federal law went into place that Medicare also has prescription drug coverage.
There.
Okay, just like enrolling in Medicare, original Medicare A and B, you have a choice if you want to enroll in it. But if you do not enroll in Part B when you're first eligible, you get a 10% penalty per year for every year you don't enroll in it. And that's a lifetime penalty.
Sure.
Okay? In Part D, the prescription drug coverage portion, you get 1% per month penalty that you get, that's on top of your monthly premium for life.
And it just accrues until you enroll in a Part D plan, into a Medicare Part D plan, and then that's
So
assessed on
important that
top of
people
the premium.
know this up front, right?
Right. Most people don't realize about all these penalties. They said, well, I didn't take any prescriptions, why did I have to enroll in a prescription drug plan? You know? And what we tell them is, well, did your house catch on fire? Have you had a car accident? Why do you have those insurances? Okay?
Of course.
All right, so we just say, you know, you can pick one of the higher price premiums or one of the lower price, depending on what your needs are and what kind of deductible you would like and a whole bunch of other stuff.
And then most people need some kind of a supplement beyond that, don't they?
Right, and right now we have several Medicare supplements, but we also have the Medicare Advantage plans. So depending on a person's needs and their financial, like if we have somebody that travels a lot, having a original Medicare with a Medigap plan is really a good fit for them usually. But if they basically stay in this area and they go to the same doctors and their doctor accepts a Medicare Advantage plan and they like that because then, and with the copays, then they'll enroll in one of those. We get the question, okay, what would you recommend? I tell them I do not have a mind and a thought on what to recommend to you. That is not my
Things
job.
can change in an instant.
Oh,
Right.
sure.
Your
People's
insurance, your
personal
enrollment,
health can change
exactly.
in a moment, and that affects everything.
And that's what
Right.
some people gamble with. You know, they go the easy route or the lower cost route perhaps, and all of a sudden something goes wrong. And they're hit with lots of co-pays, high deductibles, whatever, depending on the plan they're in.
Right.
But again, it's understandable. I mean, people just don't have the money to buy some of these plans.
Right.
People are living longer, healthier lives than
Exactly.
ever before, and that changes people's attitude. If
Right.
they live well into their 60s, 70s, 80s, and sometimes 90 without a catastrophic illness, they're liable to look in the mirror in the morning and say, what do I need this stuff for?
Right.
Guess what? Tomorrow morning, something can happen.
Right.
I like your analogy with the flood insurance and the fire insurance and all of
Right.
that.
Right.
But the whole, I'm afraid that we've scared people to death here today,
No.
but we shouldn't be.
No.
Should let you know that Linda Thomas and Dorina Casio are here to simplify all of this for you. And if it takes, what they said, 2, 3, 4 hours to sit down,
That's
you know,
fine.
I have a thick skull, and if it takes that long to get through to me what my wants and needs might be, so be it. But that's why you're here to help people.
And I also ask them, our clients, to give us a call if they have a question. A lot of times, you know, they drive all the way in from Cherubusco or somewhere. They can't see either one of us because we're with someone. Meanwhile, they've got a letter from Epic that we may have been able to explain it to them over the phone.
Right.
You know what I mean?
So
And-
call first.
Sure.
Yeah.
If it requires an in-person
Sure.
appointment,
Exactly,
Then we'll make one.
exactly.
But that's the thing. We have I have people, and Linda does too, that they'll walk out the door and we try to go so that they understand stuff, but sometimes and we tell them, bring family members, bring
Yep.
a second year, bring whomever
oh,
you're
that's a
comfortable with.
wonderful idea.
So we tell,
Take notes.
we do.
Take the brochures.
Yeah, we do, anything they want, take notes. If we make copies, we always have them right over it, whatever they want, and we'll go through it at any pace that they want. Have them interrupt us whenever they're here, ask questions. But we have people that will leave us, and they may just get home, or it may be the next morning, and we'll get a phone call like, okay, we talked about this. Is this what you mean?
Right.
You can understand that.
Right.
People are under stress when they deal with professionals, and they're not used to that. It's like
Yeah.
when they go to the doctor's office and don't write down the questions they have. They spend their 15 minutes with their private physician and go home and say, he didn't answer any questions because you didn't ask any.
Right. Yeah.
So-
That's true.
But and we always tell them, don't. And I have one person that calls me every once in a while, and she'll go, Doreen, this is you know who, and I says, yeah. She says, I have a stupid question. I says, I haven't heard it yet. So she's trying to come up with a stupid question. I haven't heard one yet, so she keeps coming up with it. But
But that's a good point, because we are in the size community we're in. And because of all those good things you said about Clinton County and the Office for the Aging, you get to know these people, many of these people very well. You know many of the intimate details of their life and their health background and so on. And it's crazy if they don't take advantage of the services you have to offer.
yeah.
Well, we
At
have
least
our
the
regulars.
information.
We have our
I'm
regulars
sure you do, like
every year,
everybody
right
does.
on the ball, and some of them want to schedule the following year.
Oh yeah.
when
You
they're
know, a
in.
point I made a few minutes ago I think deserves to be reiterated, and that is your services are not only for people who are right in the midst of all this now, but people who might be retiring if they're 57 years old, 58 years old, looking at retirement. What are we looking forward to?
Right.
I don't want any surprises. It's
Yeah.
like I did when I considered retiring from the county after 8 years. The first thing, I made a beeline for this office. I said, okay, what next?
Yeah.
And armed with that information, plus the New York State retirement system, and you meet with people, and you talk to your banker, and you find out what's going to happen,
Right.
and then you go into it with your eyes a little more wide open.
Right.
Is there anything else about Epic or about Medicare that we should cover today? Can you think?
The Epic, has determined that everyone that wants to be enrolled in Epic will have to be in a Part D plan.
Right.
Medicare Part D drug plan. They have to have a Part D drug plan. Previous to that, people that had other creditable coverage or people that had the veterans did not have to take Part D. Now they do. Coming next year.
Or we have people that are in the Medicare Advantage plans. We have a lot of them here in Clinton County that are Medicare Advantage plans that do not have a prescription drug plan with it. But Epic has, before, up till now, said, well, Epic will be your insurance coverage for your prescriptions. That is no longer true as of January 1st. So people have to know that if they do not enroll in a Part D plan, if they go to the pharmacy as of January 1st and do not have a Part D plan, they will not have any drug coverage.
No, because Epic will not come in.
Epic will not cover.
That's an absolutely wonderful point
Right.
to make.
Right. And people, we have people that have prescription drugs that are really expensive. And the Part D plans were set up with a donut hole. It's called a coverage gap. And this year I got their prices down. The coverage gap is, with the actual cost of the prescriptions, $2,840 up to $4,550. That's the coverage gap, where before a person would have to pay the entire cost of the drugs. Starting this year, it was any of the brand names, they pay half price, and the generics they could pay anywhere from about $3 up through the entire price of that drug. But during that period, Epic will help anyone that's enrolled in Epic cover their drugs at the regular Epic price up to the $20. But that is, according to what we have now, the rules and regulations as of January of 2012, that is the only time Epic's going to help
So
cover
it'll be only the
prescriptions.
donut hole.
Will be only the donut hole. So deductibles, whatever the actual copay is with their Part D plan, that's what a person's going to be paying out of pocket for their
You know, we're in a
prescriptions.
digital age now, and if people aren't aware of it, there is better communication between all offices, doctors' offices, insurance companies, and as of recently, they are able to share information digitally
Right.
about what medications you're taking and so on.
Yeah.
And it's something that people may not be aware of, but there is a way to communicate and coordinate efforts like we've never had before, thanks to this digital age. It's where you have digital prescriptions, where the doctor doesn't have to write in that funny language that all doctors write in anymore. It's all digitally. When your prescription is ready to run out, guess what? Zippo to your pharmacy and it's all ready for you. Things like that have made life a lot easier,
Right.
in spite of all the other things that make life a lot tougher for all of us. But it's really true, and what you people are doing and adding this level of information to people, directing traffic. You're traffic directors in many ways, aren't you? Hands up here, go
Sort
in
of.
this direction, head down this way. And then you talked about open enrollment. What the heck does that mean?
During open enrollment, anyone that is enrolled in Medicare with any of the insurance programs or that includes the prescription program can come in, do an evaluation on what they have, compare it to what's available for the next year, and change whatever portion they want for next year, and it will be effective January 1st of the very next year.
And you
that's
know, many
2012.
people are resistant to change.
Oh, yeah.
They don't want anything to confuse their life anymore. If they have a car insurance company and it's a next door neighbor who's a friend of theirs, even though they can save $500, they don't want to look into change.
Right.
But the open enrollment gives an opportunity to actually adjust to what your new needs might be.
Right.
Exactly.
Right?
And they, at the same time, the plan that they're in may very well be changing. Your premium may be
Another good point.
$29.20 now. Next year it might be $42.12.
Yeah.
And if you don't catch it and you don't do anything about it, you're stuck in that plan.
Right, and we had a plan that, two plans that joined this year.
Right.
And it was one of the benchmark plans. The benchmark plans, anybody that's is considered a full dual that has Medicare and Medicaid, that has any of the Medicare savings programs or the extra help program, or within the income levels of Epic, though their premium is basically paid for through those programs. Okay, so they may not realize it, but one of the programs that was being paid for previously joined with another one, so it went from a benchmark plan up to over $55 a month. So all of a sudden these people were getting a bill for about $18 because that was the amount above what the benchmark price would pay for. So they were all of a sudden getting this bill. Some people weren't paying it because they were figuring it was a mistake, and then they got notices that they were getting dropped.
And they were getting a bill from a company they more than likely never heard of because the
Yeah,
two
true, that's a
previous
good point.
joined and had a different name.
Well, who knows how many times your mortgage is going to be sold to
Exactly.
some bank in
Right.
Cucamonga that you never heard of.
Exactly.
It's
Right.
no longer, you don't
Right.
any longer deal with the guy next door,
Yeah.
except in the Office for the Aging. And these are the people who are always next door. There are a lot of people who have Medicare, or Medicaid, I should say, and
Right.
Medicare, who aren't eligible for Epic because it's income driven, right?
Well, anybody that's Medicare, Medicaid would not be eligible for Epic anyway
Anyhow.
So,
because they have Medicaid.
yeah.
Yeah.
Lots of people have Medicare who aren't eligible for Epic
Because they're over income, yeah.
because over income.
Mm-hmm.
And this whole business of health insurance is getting more complicated as we know because of new laws. But people who work for an organization for a long time, like state and federal employees who were tier 1 and so on, who have lifetime health benefits and so on.
Thank you.
right?
Yes.
That further complicates the matter when they try to figure out who's going to pay for what.
Well, the thing is that if somebody has employer insurance and their prescription drug coverage is credible and their insurance company will send them a letter once a year telling them this, which we tell people, file it, it's as good as gold and will save you a lot of money.
Oh, you got it.
Okay,
baby.
so we tell them, if you have really good insurance and a credible prescription plan, if you try to enroll in something else, especially prescription drug coverage, it could kick you out of that insurance forever. You may not be able to get back in. And if that insurance
Think about that for a minute.
right, and if that insurance covers a family member, then that family member could lose their insurance and you may not be able to get them
Oh
back
boy.
either.
Oh boy,
So,
I'm glad we brought
yeah,
that up.
Yeah, so that's what we tell people. And we get phone calls from a lot of people that are getting ready to, that are turning 65. They may be still working. They go, do I have to enroll in Part B? And then we ask them, how many employees are with your company, with, insurance stuff and that kind of stuff. Because a lot of people in this area are putting off their retirement until full retirement age at least. And a lot of people, full retirement age is closer to 66 now. So they're putting off their full retirement age and working with an employer that has really good insurance. So we tell them that you could take Part A, and we send them the information so that they have it in case they run into problems later on, that they could put off their enrollment in Part B until they're ready to retire. They really have 9 months after, but that means no insurance for 9 months sometimes. So we tell them, you can put it off, just sign the paper, send it back. But let Social Security office know when you're ready to retire so you can start your Part B.
We mentioned before we went on the air here that you do have a pretty close connection with the Department of Social Security.
Mm-hmm.
So that you almost have a hotline so that you can be in touch with those people because
Right.
it's part of the whole package.
Right. When we call...
Well, we sort of demanded it, didn't we? We would say, but we gotta have a
Well, you
callback.
guys
We're
could
not-
do it if anybody
So
could.
I said to Doreen, we gotta have a mechanism because people are right in the office. We need to get an answer,
Yeah.
And so now we did, and there's no problem. We
Yeah.
hooked up,
Yeah.
Doreen hooked up with Beppy Sibley, and we can usually get her anytime.
Yeah,
If she's there.
Yeah, but we often call the same number everybody else does.
Yes.
Because that's the number they would have to call. And we get through that way. If it's an emergency
Yep.
and we get put through to somebody's voicemail or something and need an answer, we will call the number that Beppy was nice enough to give us, and that one doesn't have an answer machine on it. It just keeps ringing until somebody answers it so that we can get an answer.
I think it's important to mention here, now that we've talked about those nice connections, that in years past we can all remember a time when a lot of these agencies were what I call parochial. What they did, all their information was contained in this little circle, and they didn't like to share it with a lot of other people.
Yeah.
This is true, and I'm not pointing the finger at any agencies, but it was that way. You lived on an island. You worked for an organization. You didn't have time to talk with other people on the telephone. You had enough work to do.
Yeah.
Now, it's why I said in the very beginning, it's not your grandmother or your grandfather's agency anymore. It's all part of a big package.
Right.
And there have to be these lines of communication, especially with Social Security.
Right. So
Well, life is not
Administration?
simplistic anymore.
No, are you
And
kidding
that's
me?
what it's all about. It's
We
just not
pointed that out
simplistic.
here. We don't mean to frighten people
No.
to death
No.
here today.
No.
What we want to do is let them know that this information is available. And I want to mention again, if you just tuned us in, that we're talking with Doreen Ocasio and with Linda Thomas, who aren't they the nicest people in the world? Just look at them, can't you tell? But you know what? You are dedicated.
Yeah. Well.
And I'm not going to cast aspersions on any element of society, but there are people who are in jobs and all they care about is when is my lunch hour start and when's my next cigarette break and when do I get a vacation around here, But there are other people who are in a job not because of these tremendous salaries that you make doing this.
That's so funny.
Don't you think that's funny?
That's a funny thing.
But it's because they're dedicated people who are humanists. They care about other people, about their fellow man. And you can't tell me that after you spend that 2 or 3 hours with somebody who came in totally blown away and confused by all of this, you sent them away smiling, that you didn't go home smiling and say, you know, I may have a headache,
Yeah,
but this has been a good day.
yeah.
And if you can help one person, not one people, one person in the course of a day, you've done something.
Yeah, that's what we aim to do. Well, we have people that come in and totally confused, and we keep trying to tell people, just call us. We may not know the answer, or call and make an appointment. You know, we have people that anybody that has Medicare knows how much information they get, and we try telling people, do not sign anything and send it back for anything free. Do not sign anything or do a phone call, because that
Opens up the door.
opens the door for an agent to contact you. And we always tell people, if you're not sure of something, bring it in. And we get people with grocery bags, plastic bags, full of information that they've received.
Do you really?
Oh, yeah.
Yes.
We
You know, that
receive,
sounds like a joke, but I can totally understand
No.
that in this age
And-
that we live in.
right, we do. They come in with bags full, and we'll sort through, and anything that's pertinent, you know, we'll go through every piece with them so that they understand what it is.
That's so wonderful to do.
So that they understand what there is, and what you know, what's important and what's not. And we ask them, do you want this? Do you want to keep this? If they say no, I often end up with a huge pile that we put through the shredder, because their address is on it, all their personal information, we'll put it through the shredder. They may end up with 1 or 2 pieces of paper.
Especially true for seniors who do know how to use the internet in terms of doing email or whatever
Right.
with their friends, and they'll get bogus offers
Oh, yeah.
from organizations that either have what looks like a government seal or a signature saying, all we need is your social security number, give us your email address,
Absolutely.
and we'll take care of you.
Right.
They'll take care of you all right.
Right. And one thing that we learned recently is people can mail order for their prescriptions with the Part D plans.
Oh,
Okay.
yes, and that works nicely for a lot of people.
Right, it does. But the thing is that they can mail order for durable medical equipment, you know, their diabetes supplies and a whole bunch of other stuff. But the thing is that some of these things that are either going on email, or they may hear from an ad or something else, and they may ask you to scan a copy of your doctor's prescriptions. What these companies are doing is taking that copy of the prescription and taking the doctor's code number and his signature, and printing up prescription pads and using them illegally. So we always tell people, if you have a question, because we get people that get things in the mail and go, this doesn't look right, and we'll say, drop it off, mail it in, or do something with it, and we'll look at it, and if we have a question, we'll fax it. We'll send it right down to state, and they will tell us, you know, this is fine, or this isn't right, and we'll let the people know that.
And even in this wonderful digital age that we live and work in, see these fat fingers, it's possible to hit a wrong key.
Oh, yeah.
And somebody has to enter that information into the system, and if they put a 6 instead of a 0, there can be blips.
Right.
So, you know, stay in touch with your doctor. Call your doctor if there's a problem. Call the office for the aging and have them explain something. But yes, there are occasional mistakes.
Yeah.
Sometimes people are billed incorrectly. Sometimes somebody goes in for a prescription they've been taking for 5 years, and all of a sudden the copay is $45.
Oh, yeah.
And guess what? The company ran out of the generic drug, so they put you on the name brand drug. And, you know, but thank goodness for doctors and nurses and so on who catch this kind of thing. Even pharmacists.
Oh, pharmacists,
Who say to you,
pharmacists are great.
Aren't they wonderful?
Yes.
Well, we get phone
Hats
calls.
off to the local pharmacists.
Oh, yeah, we get phone calls from them with questions. If they're running into a problem because of something, or they run into a client and they have a question, they'll call us. We'll look it up. We'll fax them whatever information they need.
And we call them when the clients are in our office, because
Right.
sometimes the clients forgot their prescriptions, or weren't sure about them, or we couldn't understand and we couldn't bring them up in the system when we're trying to input it.
Right.
We call the pharmacy and they'll give us the information.
Right.
Like having your favorite physician that you've been
Uh-huh.
to for years, whom you trust. isn't it nice to have all these neighborhood, people say, there's a drugstore on every corner now.
Yeah,
But guess what? It makes it so nice when you walk in, you're familiar with these people, they are your friends in essence, and they don't give you a new prescription unless they say, any questions?
right,
And you've got to push a button or sign
Right.
off if you don't have any questions,
yeah.
and they'll advise you in so many ways. And I'm so glad we brought that up here, because
Well, the
nowadays there's a drug for everything, no matter what you got going for
Oh,
you.
yeah.
If you sweat too much,
Yep.
you take a pill, you
Yep.
know?
but the other thing is we always try to encourage our seniors to use one pharmacy.
Mhm.
Well, I know
Yeah.
I can only speak for myself. You know, we talk about senior citizens being 60, and Kay and I
Yeah.
have several kids who are more than 60. So, and you know, none of us feel old in this room, even though we
Right.
know we're aging. We just try not to look in that mirror every morning. But you have that pharmacy. You have
Right.
those people who recognize you when you walk in.
Right,
And they won't let you go out of there if you have a question about that.
right.
And isn't that
And the side effects between drugs now. So
absolutely so many things
if
affect
they're
so
using
many
one
things.
pharmacy for one thing and one for another, but I tell them, I said, if you have a prescription drug plan, no matter which pharmacy you go, it's going to be the same price.
Yeah.
So you might as well just use one pharmacy. That way they know all that stuff, and they also, you can talk to them about your over-the-counter information, so that everything can be there, and you can find out, well, there may be a side effect with taking this with this, even though it's an over-the-counter vitamin or a
Oh, sure.
nutrient. So that way they can sit down with their pharmacist and go over the whole picture at one time, not just bits and pieces.
So we're going to pause for a minute now. We're talking with Doreen Ocasio and Linda Thomas about what's going on at the Office for the Aging. All right, we're going to recapitulate, and we're going to add some things that we didn't talk about. We are in the Office for the Aging with Doreen Ocasio and Linda Thomas. And Calvin had some of his own questions. You see, you
Yeah.
can't see behind the camera. We can, but
Yeah.
those people who are viewing this program can. And he views himself as a baby boomer. I don't know if I've ever put him in that category in my own mind, but we're almost exactly 10 years difference in age.
Oh,
So I'm already well into this stuff. I already had my sessions here before I retired. Calvin is on the cusp. I don't know if he ever feels like he's on the cusp or not, but he is. And so we need to talk to those people who are 60 and older. And you mentioned while we're off camera that your grant allows you to talk to people who are 60 or older
right.
about what's pending.
Right. Well, our grant is set up so that we can work with anyone 60 or older. So if somebody's turning 60 and thinking about, well, what do I have to look forward to, or my parents have gone through all this and I don't want to have to go through that, I want the information. We always tell them, call us and we'll be glad to make an appointment. They can also call JCO to have a senior outreach worker go on out and sit in their home. They set up appointments that are really conducive to different people.
Joint Council for Economic Opportunity, a very important organization here, as you well know, having spent how much time with them?
From 96 to 2004.
There. And important in so many ways. We did a program with them and about them some years ago here,
Right.
and we probably deserves an update sometime, but that's true.
Yeah.
It's important for then somebody to call here, make an appointment with you, or call JCO directly.
Right. And be able to sit down and see what options they have. Because we have a lot of people that don't want to wait until they're old enough for Medicare, don't want to wait until they're 65. They want to retire around 62 and start drawing their Social Security and start living with that. And they want to know what kind of insurance, if I can't continue with my employer insurance, what insurance options do I have? How much is it going to cost me? So we try to give them that kind of information, that kind of guidelines. And also, answer all the little questions that they may have. And it's nice to be able to have somebody come in and do initial stuff. And that way they get to meet us and know that we're there. And they also give us a big boost by giving referrals and other things out there. But we'll be glad to do that with anybody, and we've talked about people on Medicare, but anybody that's disabled that's younger than the 60 years old and been disabled for the 2 years, and all of a sudden they get their Medicare card for Medicare A and B, and they go, well, this is fine, this is all I need. But Social Security office will often tell them, and their friends and other people will say, you better go down and talk to them at Office for the Aging, because just having your Medicare card is not everything. You'll want to know what goes with it and how it works and stuff. And we do that with anybody eligible for Medicare, and people that are 60 or older, we answer any of their questions, because as we know, some people are retiring at age 62 or as soon as they can draw their Social Security, but other people are waiting until their 70s before they decide to retire. So we have a wide range of people that go, what ifs? And we try to answer and fill in the what if blanks.
Options.
Well, I think people under, say 62, 63, they want to retire. Certainly they've looked at their income. I would think that they're thinking, well, I think I can do this, I think it'll work. But one thing they have to remember is to check on their insurance, because you're not eligible for Medicare until you're 65 unless you've been disabled for a period of time. So some people have no health insurance till they're 65 years old.
There are some things you can do, and there are some things you must do at a certain age, right? And at 65, what do you have to do?
Well, at 65, you should.
You don't have to do anything.
No, you don't have to do anything. You should contact Social Security office. Even if you're not going to draw your Medicare, not draw your Social Security, either 3 months before your birthday, your birth month, or a little while after, you should contact the Social Security office. Even if you're working, you can get your Medicare Part A for free, which will help
That's a good point.
which will help you pay for any hospital bills if you get admitted to the hospital. You can deny, if you're working and your current insurance is through a current employer, then you can postpone your Part B. But that's the kick. It has to be a current employer.
Right.
It can't be a retirement insurance, because we have people that have been working, retired, get a retirement insurance, and go back to work.
Of course, lots of people now.
And their insurance is from a previous employer. Well, that previous employer insurance is fine, but if you turn 65, eligible for Medicare, and that's not your current insurance, current employer insurance, then you have to take Medicare Part B. So there's all these little loopholes and little ifs, ands, and buts that we try to help people answer their ifs, ands, and buts.
And some companies, you turn 65 and you're on Medicare. They want you on Medicare.
Right.
You can be getting your group health insurance, everything's fine. Turning 65, you go to Medicare.
Right.
And then they may or may not come in with a supplemental form of insurance.
Right. So that's why, we tell people, check with your human resource people.
Absolutely.
Find out what it is. Make an appointment with us. We'll go through everything with you. If there's any more questions, we'll be glad to call them and talk, with them when we're here, and we'll try to fill in their blanks to see. Well, I'm turning 60. I'm turning 60. What's my future looking like? Well, we can't predict the future. We can tell you what it is like right now, or what the laws are going to be for, some of the laws for the next year. We can tell them when we know them. But this will give them insight as they're budgeting and figuring out costs, whether or not they want to retire at 62, what their cost would be for insurance if they have to buy their own.
And it's very expensive.
And a lot of people are retiring or getting out and going on COBRA, and it's not carrying them through quite enough for them to get something else.
That's been a horrible option for
too.
people who were out of work during
Right.
the recent economic depression. Some people out of work 2 or 3 or 4 years, you get to COBRA for a while, and all of a sudden you got the whole shot.
Yes, right.
Or you opt not to have any insurance, and then
Right.
you have an illness.
And we have people like that.
Mm-hmm.
We do.
So what we're saying here is that many of these cases, you have to build a case for individuals when they come in
Exactly,
here.
exactly.
It's almost impossible for us to
Exactly.
cover every eventuality for a person who's now 62 or 3 or 4.
Or turning 60 and
or
wondering.
turning 60 and wonder
Right.
what the future might have.
Right.
And their
So
spouses,
make an appointment.
partners.
Right.
Yeah, and spouses with insurance, and you didn't have insurance, and you work for different companies, or
Right.
you want to be covered under your husband's or your wife's insurance.
Right. Right. That's why when people come in for anything, we often tell them, you may fit into a specific insurance category, group, anything, but a spouse may be entirely different. So we let people know that we're hoping that they understand that they may have to pick and choose on different options
There are
for
options.
that person, but there are options, and a lot of the options will be able to fit to a certain person. We do have people that are in that age group, that's 60 to 65, that are over income for a lot of the programs, and individual health insurance is really expensive, but if they want health insurance, a lot of people are just willing to go ahead and pay it, because they say, well, I want to retire and I want that insurance. So they're willing to do that, but they want to know their options. Otherwise, is this the only way to go? Is this the way to go? And we try to explain that to them.
And we're trying to stay on top, we feel, in the next, year or two with the health insurance exchanges.
Yes.
With Obamacare, and we don't know how that's all going to shake out and how that's going to impact our people.
You
Yeah.
think you have questions now?
Yeah.
But that's an important point. I'm sure for many people watching this, all they're doing is shaking their head till they can hardly watch television because they have more questions than they had when they started, but that's why you're here.
Yes, it is.
What we did is we're opening that door.
Yeah, because what I tell some of my seniors that come in is when they're looking at all this and asking all these questions, no matter what age they are, if they're disabled and under 60 or 65, or if they're 60 and they want to work for a while but they have questions, we know that it's a lot of information, and we feel like you feel like that you're a deer in headlights and you're not sure which way to turn or which way to
Sure.
run. Okay, so we tell them, call, make an appointment with us, we'll sit down and answer all your questions, and we don't care how many times you call back, or if you get a piece of paper and you're not sure, call us. We'll be glad to go over it with you. And Office for the Aging, our portion of the program is not income based. Okay, so no matter what income level you are, or what you're doing in life, or where you are in life, if you're 60 or older, or about to begin Medicare, no matter what age, we'll be glad to sit down with you and answer
And it's
your
free.
questions. It's free.
Free is those car advertisements.
Well, everybody pays for it with their taxes. Thank you very much. but
you
we
know,
do
you're
not bill
sent a
anybody.
bill from Office for the Aging. It's a county agency.
Right.
And you talked about some sessions that you have. We're doing this in July, for example.
Right.
Some people might not be watching this until who knows when.
Yeah.
But you're doing regular sessions that people could attend, right?
Well, we're doing two sessions in the middle of July on the 11th with Candy Rivera Whitehead. She's the representative for EPIC for this area.
I see.
And she's coming up. But I've already been asked to do some of the senior housings, and I've
So you
talked
go to
to-
you'll
Oh,
go to
yeah.
various
Yeah.
venues.
And if an organization or a group would like to set up a time, I'll be glad to sit down with them and go over all this stuff. When I do the sessions, it's a lot of I do give information which I try not to overwhelm people with, like I
difficult.
feel like today, but I try not to overwhelm them. But it's more like an individual one-on-one and bouncing questions and people bouncing questions back and forth. I have no set venue. I kind of know the information I want to cover, but I have no set venue or say, well, this is it, because whatever people have questions of, and I happen to be there, I'll try to answer them.
And if you don't know the answers, you'll go back and
Oh, yeah.
see where you can
Oh, yeah.
to
We
get that
also go to our
information.
state people a lot, Office for the
Sure.
Aging.
Oh,
We
yeah.
have a couple of very good contacts there, and they get right back to us,
Oh, yeah.
and they answer their phone.
Oh,
It's
yeah.
great.
Yes, They answer their phone and their emails. Sometimes
Yeah.
we'll email something to them, and in less than 10 minutes, we have an answer back.
Sure, it's important for people who are confused over this whole thing. Calvin and I sit here. I've been involved in it for a long time. Calvin he's on that cusp I talked about, so he'll be getting there.
Yeah,
We're saying, oh my gosh, what are we in for?
yeah,
But very few of us know what tomorrow's going to be like anyway,
Right.
in terms of how the government is run, how these
Right.
programs are going to change,
Right.
how much we're going to
Exactly.
get for Social Security raise next year or whatever it happens
yeah,
to
if you
be.
get one.
So you call today, and
Right.
I say we, I'm under the umbrella here. We'll try to answer your questions the best way possible.
Right,
They can contact you via email
right, they can.
and at the telephone number again, which is
565-4620.
she remembered it twice in a row.
And always bring your insurance cards with you.
Oh, good point.
Always, whether it be group health insurance, Medicare, because
Whatever.
we need sometimes that information when we make calls to get further clarification of the kind of insurance they have. Because people are here sometimes from other states with retirement
Of course.
insurances.
Good point.
We never heard of this insurance.
Oh, yeah?
Yeah,
That's an excellent point.
yeah,
Bring some information
Yeah.
to help. One thing we're going to wrap it up with today, and this is Vital Links. Tell me
Right.
what this is all about.
we've been working with the CDPH and with the EMS squads. EMS squads have been putting these in their ambulances.
I noticed that.
Right, and CDPH have been handing these out as part of the discharge. The yellow sheet that's in there, a person can list all their medications, over the counter as well as prescriptions. They can also put in their information about contact people, their doctor's information, a whole lot of information. They can also, if they do not have a DNR and they
Do not
want one,
resuscitate.
do
yes.
not resuscitate, or a healthcare proxy, or a MOST form. They can
A what form?
A MOST form. It's a MOST form is very specific. It's filled out by a doctor. It's very specific care that a person
I see,
desires. Okay, they can make those out, copy them, and put them in their file. What we've been telling people is use this as part of your health care. When you go to the doctors, when you go to the pharmacy, bring this with you. They can pull out the yellow Vital Link form. They will have a list of all your medications, dosages,
Right there.
and when you want, right there. And
Put
if
a
there's
picture in
any,
there. Put a photograph in there.
There's a list that they can put on
Is
there.
there really?
Oh yeah, right.
It just dawned on me.
There's a list of things that they can put in here, and a picture is one of the things they can put.
Oh,
in there.
here. You may want to include a recent photograph of yourself.
Right. Especially if you bring it to the
Medical
hospital.
appointments,
Mm-hmm.
business cards, agencies you're working with.
Right.
So, police, emergency medical technicians, firefighters, hospital emergency staff, physicians. Once again, it involves communication.
Right.
It's like wearing an ID bracelet if you're taking a specific drug or need, having the information available so somebody doesn't have to second guess it. when
Right,
it gets
right, and there's also a sheet in there with people with disabilities, how the EMS should react or treat these people or handle these people, lift them a certain way or do that kind of stuff. That's also in there. But these forms are for anyone here in Clinton County that takes medication. So if you have a baby that is born with specific drugs that they take, then you
yeah.
fill that out and it goes on the refrigerator. If you have an emergency with that person, you don't have to go and grab all their paperwork. You can just grab that off the fridge.
It's got a everything's got a magnet. Well, this goes right on the refrigerator,
Right,
so
that's
it's right there.
Right, and
That's a good point. What
and
a
the-
great
yeah,
service.
and the MS squads are really good, and they've been working with this program for a couple of years now, and they'll go in and just grab it out the refrigerator, and more people here in Clinton County are using them. I think you've gone through how many?
Thousands.
Have you really?
And
Right.
we're in the process of ordering more.
Right.
So we're doing this in July,
Mm-hmm.
in early July. More information will be disseminated as time goes on. September, October for open enrollment.
Right.
So many things. We want to leave our viewers with this message. Call.
Yes.
Make an appointment. If you have an uncle or a brother, husband, a spouse, anybody who might want some of this information someday, if they're 60 or older, they can contact the Office for the Aging in Clinton County or whatever county they're in,
Right.
whatever state they're in, and get information, if for nothing else, for peace of mind. So you're not not waking up tomorrow saying, oh my gosh, I'm too late, I was supposed to do this yesterday.
Right.
People
Right?
have enough on their mind nowadays.
Doesn't it?
Right.
It's a complicated world, Linda and Doreen, you guys are wonderful.
Well, you are always a pleasure.
Thank you so much for joining us today, explaining all these things to us the best way you can, but there's nothing like that one-on-one,
Right.
Absolutely.
and that's what we're leaving people with, one-on-one. Office for the Aging, Clinton County, JCEO, come right to your home if you can't get out, and let's wipe the smudge off that mirror that we talked about that is the rest of your life right here today, starting with your organization. Thank you so much for being with us today.
Well,
Thank
thank
you.
you for
I
having us.
loved every minute of it.
Well, we did too.
I want to thank our viewers for watching this program, because if we didn't have viewers, we wouldn't have a program. Thank you for your suggestions and your comments and your ideas about where we can go next. It's important, if you are watching this program on a public access channel on your favorite cable system or on the internet at Plattsburgh.com or HometownCableNetwork.com, that you realize that this is a labor of love with Calvin and I, but somebody got to pay for the gas. And so those people who watch this, especially the individuals who find some real interest and meaning in it, and businesses throughout the North Country, if there's any way you can make a monetary contribution, please send that. As generous a check as you possibly can. Or if you see Calvin in person at one of the many events he covers every year, show him you care by giving him a contribution so we can buy the gas for the next trip we have to make to Churubusco or wherever it might happen to be. Thank you all for everything you do, and I always say, who knows where we're going to be next time for our little corner.